Hi everyone. Good morning, good afternoon, or good evening from whichever part of the world you're joining from. Today we are here in one of the events of Brazil's Women in Data Science. So, talking about women in data science, it actually started as a one-day technical conference at Stanford in November of 2015. Now it has emerged as a huge conference with 150 plus regional events, a datathon, a podcast series, an education outreach program, and even a workshop series in 2021. So the conference comprised of 2,000 plus attendees from 65 plus countries. We had 200 plus events, 60 plus countries, and 30,000 plus attendees in that. We also had 40 plus speakers from 25 plus countries. How amazing is that? And finally, we had 1 lakh plus participants joining online. So, talking about the conference again, we have 8 talks from amazing speakers lined up for the month of March. The ambassadors of Women in Data Science Brazil are Arti Kumar and Maja, and the platform and community partners are DeFi. So the 8 talks that I was talking about range from 9th March to 1st of April, and we are on the 4th talk right now, which is today, 18th of March 2021. Today's speaker, Karen Pesci, is a digital advisor at Microsoft with a background in nanotechnology engineering, biotech, and material sciences. During her career, she worked in strategy and delivery for a series of LSHC multinationals, as well as other industries, and specialized in digital health. Today's session will be about data, life sciences, and healthcare, the latest trends in digital health. So I will pass the control to Karen and welcome her to the stream.
Thank you very much. Can you hear me?
Yeah, we're able to hear you fine.
And soon you should be able to see my screen as well. Can you see
Yeah,
my
we're able
screen?
to see your screen as well.
Amazing. So thank you very much for everyone to be here today, in which I'm going to be presenting basically topics around life science and healthcare that involve data. And first of all, I'm going to give a summary of everything that is happening in digital health, and also a summary on what is data, right? We are going to deep dive in the importance of this mix between digital health, data, and why going to a digital approach for healthcare. And finally, on the 4th topic, I'm going to talk a little bit more about the latest technologies. So first of all, digital health is basically everything that has to do with digital and with healthcare. It can be something to do with hospitals, to do with life science companies, biotech companies, pharma companies, and it's getting more and more trendy today to apply digitalization to the sector. What we can see today that is happening a lot is a lot of projects over telehealth and virtual care, which are basically providing a very personalized care to patients that can be anywhere. And this prevents a series of burdens, for example, going to the hospital. Very often, when I contact hospitals and I say, okay, what is your biggest issue at the moment? And they say, a lot of the patients that come to the hospital, they didn't really have to. We could have done this on the internet, but it sounds so amateuristic to do it over the phone or over the internet or on the platform. Or sometimes they don't have the ways, the means to do it online. So how can we take telehealth and virtual care to the next level so we make it really official and the patients don't have to go to the hospital for that? And especially now during COVID times when getting infected is so easy. If we can avoid that, it's definitely good. Another thing that we see increasing in digital health at the moment is the adoption of mobile apps. And especially now that everyone has their mobile phones with you, it's something very easy and very, yeah, it's something that is always with you. So For example, mobile apps are great to incentivize a change in behavior. They are great, for example, there are a series of mobile apps that incentivize you to sleep early, and they track your sleep and they tell you what are your sleeping patterns. They also help on mental health. Mental health apps are becoming super popular. Health trackers, especially with the aid of smartwatches, life logging apps, fitness apps, for example. These are all falling into the category of digital health and more specifically, digital therapies. And even here on the screen, you can see an image of a mobile app which is tracking patients with diabetes. And you can get a series of insights from the data that is being inputted in the app. I'm going to talk more about it afterwards. It's just a brief overview. We also have smartwatches and other wearables which are helping on the personal health information tracking. Why is this so important? Because let's say, for example, you feel something, you perhaps feel your heart racing during the day, then you go to a doctor and you say, oh, my heart was racing yesterday, and I don't know why. And that's pretty much all the information that you can give to a doctor. Whereas if you're wearing a smartwatch, it probably tracked for how long it was racing, what was the beats per minute, and what was your recuperation time. So you have a series of information that you wouldn't have if you were not wearing a wearable. And of course, smartwatches also help you adopt new behaviors like the mobile apps as well. Another thing that is getting very trendy at the moment are chatbots. And I'm also going to display a few examples of chatbots. And they are helping patients, for example, even prescribing medicines. They are conversational chatbots that talk to you. Especially in the mental health sector, there are a lot of conversational chatbots, and they're also highly informative. So you can input your information, you can input your questions, and they are going to give you an information that you need. And this is also very powerful because it will avoid a lot of people to go to the doctor for reasons that sometimes were not strictly necessary. You didn't really have to go to the doctor, but you didn't have anywhere to go to. Perhaps you're a bit skeptical to just put on a search tool, what do you have? And in these chatbots, you know that there are doctors behind. They're making sure that you get a correct information. Augmented and virtual reality is something that got a lot of traction, especially during COVID. And this is one of the main topics that I'm going to be talking about today, because it's one of the main trends that are going to be coming in the future. And they have such a series of applications. They give you an effective way of learning, and you're going to see in the videos. They can bring the physician to the patient remotely, and that's still a challenge that people are working a lot at, but very exciting. And yes, these are one of the main topics of digital health at the moment. So, but first of all, I just want that everyone on the call understands what I'm talking about, because one of the things that you learn when you're in an IT company is that not everyone is so tech savvy. So let's make sure that all the people here in the call understands what I'm talking about. So first of all, what is this data that I keep talking about, right? Data is nothing more than information. It can be information that you are gathering from a person. It can be information that you're gathering from something. So here on the Wikipedia example, you say data or units of information can be numeric, and they're collected through observation. But the thing is, when you collect this information, when you collect this data, which in the case of a person can be the blood pressure, can be the sugar levels, can be the weight, can be the heartbeat, or even in the case of your shower, of your showering behaviors, can be the volume of water time of running water, average time, water quality. Once you get this data, you get a much better overview of what's happening about this topic. So for your shower, for example, you can see the whole pattern of showers in a building, and you can see if showers are getting unclogged or if there is a problem with the water quality. Perhaps one pipe is leaking somewhere, and then you can avoid a bigger leakage. And the same happens to a person when you have data tracking of the weight, of the heartbeat, of the sugar levels. You are able to get a much better overview about yourself, and you are able to, most importantly, take actionable insights, which is you're able to go see someone, see a doctor before something happens, or you're able to take a decision, perhaps about your diet, about taking a medicine, much more informed than if you didn't have this data. And this goes to the part, why is it important? It's really important to get accurate conclusions because you really know what's happening. You have enough evidence of what's happening. You have the time frames. You can make actionable insights. So after the collection of all this data, most of the diseases are going to be able to be predicted. And here on the example, you have a mobile app which is tracking sugar in your blood. And the mobile app can go as far as saying your blood glucose is likely to be high in the next 3 to 6 hours. So you can do something about it. Perhaps you can take your insulin before this happens. You can prevent yourself from something that would not be so nice. And after all, the reachability topic is also something very powerful, because when you're connecting all this information, typically this information stays in the cloud, stays somewhere on the internet. You have access to it everywhere. If you have central platforms in your country which are collecting data, all your doctors are gonna have this data available for them to see what's really happening to you. And here also an example of a chatbot. You have, hello, Peter, how can I help you? I have a runny nose and a headache. Okay, Peter, I understand you have runny nose and a headache. How long have you had these symptoms for? And all of these interactions, they keep logged, right? So you also have a great overview of, for example, the patterns of you being sick. You can see that, wow, in this year I was sick 5 times, and during COVID, because I wasn't seeing anyone, I got sick only 1 time during the day. So the tracking part is really powerful. The reachability part is really powerful. The fact that you don't need to go to a hospital, the fact that a doctor can work on more urgent cases because you're not going to be there, are also very powerful. And here we have also an example of Ebags, which is a company from the UK, which is getting a lot of attention at the moment because they just raised incredible fundings. And they're researching in cancer, right? So they're using imaging to detect cancer in better ways. And the way data is powerful in this case is that they got a lot of those lab pieces of glass, and they analyze these extracts. And through this analysis and through feeding machine learning models, they are able to analyze in a super fast, super accurate way and find cancer much faster, much more accurately. So I wanted you guys to imagine a scenario. You have a stroke while camping in the middle of nowhere. You're in the middle of a forest, you're maybe in the Amazon forest, and you're taken by paramedics to the nearest ER, where you're told that there are no stroke neurologists around. So, yeah, what do you do then? Well, luckily, the ER has video conferencing equipment connecting it to stroke neurologists, which are based somewhere in the capital, somewhere else. So these stroke neurologists are able to assess your neurological functioning, and they can also provide acute stroke treatments all from a distance. So that's what I'm saying. You have a stroke, you're in the middle of a forest, you go to a place, and a doctor much further somewhere else is able to assess your state completely. So in this way, telecommunication technology in healthcare, or what I spoke about before, telemedicine, plays a key role in saving the life of someone who needs immediate specialist care. And that's what I keep talking about, the power of reachability, because this person is often too far away from specialists, services, doctors, physicians. So in any other case, this person would unfortunately die. And for you to understand what's happening here, I'm just quickly going to run through the concept of cloud. And cloud is like a big group of computers and storage devices somewhere. The concept of cloud actually comes back to the 1960s when they started drawing patterns, frameworks about it. And every time they would refer to the internet or to the connected network, they would draw a cloud around it. And then people just started doing the same. And then suddenly Google and Amazon were calling it cloud, 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 and the term caught on. And the most powerful things about the cloud are that you are able to store a lot of data inside that typically just a computer wouldn't be able to store. You have very powerful computers that can make a lot of calculations really fast. It's basically giving you the access of a massively gigantic computer that you can use on demand. And here is the picture of the network. One of the first patents that were using the cloud drawing, where the name comes from. And now that you know what is cloud, I am going to give you this case. Every 20 seconds, someone has a leg or foot amputated due to diabetes-related complications. This is the data that David Armstrong provided. And once the amputation takes place, 5-year mortality is between 50 and 75%. So basically, diabetes-related complications are similar to the most dangerous types of cancer. And there are ways to prevent that. And one of them was created by this doctor together with a company in Italy. The team began to create basically a smart boot with Internet of Things, with IoT sensors. And these sensors were all connected with specialized software, and they started monitoring patient health data. Because one of the things that would happen is they put a boot on a patient. The patient has no idea if he has to remove it, for how long he needs to take it. So with this tracking device, the patient has exact knowledge, he has really the disease on his hands. And that's one of the most powerful things as well about digital health, that you have the sense that you have it under control. And of course, this was a big project. They needed a lot of development. They needed fast development. Because of course, the sooner the patients and the doctors could start using this new device, you could start saving limbs, right? So these were very important goals for them. And when you need to select things so quickly, when you need to build all these enterprise class applications for all the doctors and the patients to use, one of the best ways is to go to the cloud. And that's why there are so many people saying today, oh, cloud is everywhere. Let's use the cloud for healthcare. Cloud is nothing more than giving a lot of storage and computer power, and a lot of the times pre-made frameworks, so you can upscale your solution much faster, and you can put solutions that will save people you can put these solutions in the market very quickly. And this was one of these cases. And since we're talking about the cloud, I'm just going to give a little jump to edge computing, which is also something that is recently being talked about a lot. And a lot of people come ask me, what is edge computing? How can edge computing actually help us? Because, yeah, I hear a lot about it. So the word edge in this context means literally geographic distribution. So edge computing, let's say cloud computing is a data center, a really big data center somewhere. And edge computing is the same, similar computing power as a data center, but on a smaller scale, much closer to the source of the data. And why are people investing in edge computing? Basically because of latency. And I'm going to be explaining latency to you afterwards. But the thing is, if you are using a chatbot, a digital health chatbot, and the chatbot has a latency, has a delay of 3 seconds to respond to you, or maybe even 10 seconds, it's not a big deal, right? You can wait. You type a message, then the chatbot loads, then it sends back to you. But imagine if you are doing a surgery remotely and you have this seconds of latency. This can be really complicated. So edge computing is one of the technologies that are trying to tackle this latency between you clicking somewhere and an action happening on another side. And please, not to be confused with edge, which is that little E that appears on your phone when your connection is not so good. That edge is something else. It's enhanced data GSM evolution, which is basically another type of 2G network. It's not edge computing. And as I was talking about the latency requirements, in digital health, you have here, for example, if you need to do something that deals with emails or on your mobile phone, on your web app, the amount of data transmitted is low. And the need for low latency is also low. You don't need to have this information immediately at the time that you click. But if you're talking about augmented reality or even gaming, if there are gamers in the call, they will understand. If you're talking about robotics or if you're talking about remote operations, which will be like very, very high need for low latency and quite a lot of, quite a big amount of data transmitted, you really need this edge computing power that will make your latency requirements much better. And goes to the top, goes to the end of the chain, which is 5G. And basically, a lot of people also ask me, I see a lot that 5G is going to help healthcare, but I don't even understand the 5G so well. So what is this? How can 5G help healthcare? And explaining 5G as if I would explain to my 13-year-old sister, 5G is carrying more data than 4G because it's using higher frequencies. So basically, 5G is going to give you higher download speed. So if you need, for example, to perform one of these tasks, like that involves robotics or remote operations or augmented reality, 5G is going to provide this high amounts of data, this high download speed and high upload speed to reach you. And of course, because it uses higher frequencies, it travels lower. So that's one of the reasons why 5G needs a lot more antennas. But if you would put a lot of antennas of 4G, you would still not have as higher download speed as you have with 5G. So that's one of the main benefits. And just to get some kind of latency check here, just for you to have an idea of why all these technologies are needed for digital health. If you have some kind of connection between the cloud to your phone, you have a latency of 1000 milliseconds. And if you already put edge computing power, then it already reduces to 10 milliseconds. If you have 5G plus edge computing, the latency is only to 10 to 20 milliseconds. So it's really precise. It's really, you're clicking somewhere in Australia and you're getting the click almost exactly at the same time somewhere in the United States. And now finally, this will all make sense because I'm going to show this video. And then now you're going to understand, seeing this video, why all of these technologies behind are so important for digital health. And please let me know if the audio doesn't work.
Yeah, I think we're not able to hear the audio, Karen.
Sorry? Is
I
the audio
think,
working?
yeah, I think the audio is not working. We're not able to hear it.
Okay, let me check. Let's try again. Let me know if it works now.
Yeah.
其实5G 呢，就是让我们可以做到在很多场合，比如说救灾的场合，还有一些像边防上，还有一些呢，就是说像我们将来的基层和大型医院的连接，我们完全可以做到，就是让外科医生做到一个标准化的术式，一个人可以去做几千公里，或者是那个几百公里，各种各样的这样点对点的一些连接。
So as you guys can see, this is already happening. This is already in test and hopefully gonna be happening soon. And now let's see how I get out of this. Perfect. And one of the things that were very, very recently launched by Microsoft is Microsoft Mesh, which is nothing more than a platform that is going to enable all these things from happening. So we already had the HoloLens glasses, which are glasses that allow you, for example, to see things like this one in the image, which were being used a lot for learning purposes, because yeah, imagine how nice it is if you can just see a brain in front of you and then you can cut it open, but it's just holographic. And now we are going to be launching this platform, which is going to mix, it's going to connect mixed reality and perhaps disrupt healthcare. That's what Forbes is planning for us. So I'm going to also show you a quick video of the capabilities of Microsoft Mesh.
Connection is a spark that gives our lives meaning. It drives us to seek out others who feel the same way.
Okay, why don't you input the data and we'll take a look together. Hey Mari, what you got for me?
To find those who share our views, yet offer different perspectives.
So this next. Look over here.
Challenge us with new ways of seeing.
That I think we should
Deepen our understanding. And enrich our lives.
最后一笔的时候往前。
Great things happen when we commit to something bigger than ourselves.
Let's take a closer look at it.
Place this here. Let's see how we go from there, okay?
This sense of collaboration and the feelings of connection it brings excites us.
Hey, just in time. I'm gonna move it slightly, okay?
It's yours, take it.
We have 2 planes right now on the same trajectory.
As we put people first, technology fades into the background and feels like anything but.
Aisha, what do you think?
I think if we had 330, maintaining 2800, we'll be clear for approach.
Excellent.
This changes the way we see the world, and in turn, changes the world we see.
These numbers are looking great, actually.
There's promise in the possibilities, and what we see and create next will stretch the imagination.
Good morning, Sarah.
Morning.
Slowly coming towards the thumb.
A world without boundaries.
Good job. A lot better than yesterday.
Yeah.
Excellent. Slowly bring the
A
arm
world
down.
where technology enhances, not limits, humanity. With people front, center, and in the spotlight. The future is here. And here can be anywhere. Introducing Microsoft Mesh.
So yeah, that's where we're heading. Very exciting, at least in my opinion. And just to make a few last comments, then you can see on this presentation, we went from chatbots and very simple ways of bringing digital health to patients, to healthcare practitioners, to very, very advanced things, as much as virtual reality and remote surgeries. So I honestly think that digital health has a lot of potential even to change the world, of course, and it's definitely a very exciting time to be working at it. Thank you very much for being here today, and if you have any questions, please let me know.
Thank you, Karen. That was a very insightful talk, and the videos were very interesting, particularly. I we do not have any questions as of now, but we can wait for 2 to 3 minutes for people to ask any questions.
How to start a career in digital health. So I think there are a few paths that you can take. One is looking for jobs on startups that are working in digital health. I think perhaps this would be the easiest one. You can also start working on IT companies that are investing in digital health, and this is very easy to find just on the internet. If you just put, for example, Microsoft and digital health, Microsoft and health, you're going to get a lot of information from it, and then you're like, haha, okay, this company is working there. And another way would be to go to a health company, to a healthcare company, to a pharmaceutical company, and work on their IT department. All these 3 ways would take you to a career in digital health. And in my case, it was an IT company that was actively working in it. And what is the work of a digital advisor in Microsoft? Thank you. I can see it in the bottom now as well. So as a digital advisor, I'm working a lot in digital strategy. So I see a little bit of the trends that exist today. Where's the world heading towards? Typically, we have specific industries, and we advise, we create a plan for their managers, for C-level, perhaps even for the people in IT in a company. And we say, look, this is something that I would advise for your company in a short-term scenario, in a mid-term scenario, in a long-term scenario. How to break into healthcare if I have a computer science background? That's perfect. I mean, you have a computer science background, you can basically work in any industry in the world. And if you want to go into healthcare specifically, as I said, you can start by going to a company like Microsoft or a digital company. You can go to a startup as a developer, as an architect, or you can go directly to healthcare companies and you can work on their IT sector. How is your work then different from a business analyst? Because their work is also to advise for the future of business. I mean, for sure it is, but I think business analysts work a lot on project level. So they make an analysis of the business and then they focus on a project. And for me, I work more on the whole business. So I don't advise them project-wise only. I advise them on the strategy of the whole business. So I can be working on several things at the same time. It's not strict to smaller topics. Do you know any blogs or channels to follow for data science, AI, and healthcare? I think if you're looking for specific information, best way would be research tools. If you are looking just for getting news, I often use LinkedIn for that. You can just follow hashtags and then you get a lot of information from it. And there's also a lot of information just on the company's websites. Telehealth is a big discussion. There are risk-related reasons why doctors prefer to see patients in person. Do you know any initiatives that are already taking place, regulatory, legal-wise? Yes, so for example, in Belgium, where I'm based, when I would talk about telehealth to a few hospitals, they would say one of the biggest pain points was that doctors were not being paid for the time they were using mobile apps to help patients. And I know that Belgium is passing a law, or perhaps it even passed already in January, in which they're going to regularize this, and they're going to also start paying the physicians for that. Knowledge in which domains would be required to make career in AI in healthcare? If you have knowledge in computer science, it's pretty good. If you have knowledge in biotech, in biology, in medicine, also helps. But I also know people that had knowledge only in business and they learned in it. So it's also a lot about your motivation. If you are tech savvy and if you're always on top of it in the news, you can basically have a lot of different types of backgrounds to work on it. Is computer science background mandatory to start a career in digital health, AI for healthcare? Well, I don't have a computer science background. I know that I have like an engineering background, but it's not computer science. And as I said before, I worked with people that had a background in business. I actually worked with people that had background in linguistics. So a master's in English and French, and they went to natural language processing, and then they went to AI for healthcare. So it's quite a bit what you wish for your career. If you really want to do it, and if you really begin to specialize in it, you can basically have so many different sorts of backgrounds, not only computer science. Do I need to do a master's degree, especially if I'm not from computer science or healthcare background, to be involved in digital healthcare industry? It depends on the country. To be honest, I think it depends a lot on the country where you're working at. I know, for example, that in Germany, they would even prefer if you have a PhD, in Belgium, a master's, perhaps in Brazil, only a bachelor. And to be honest, depending on what your wish is, if you want to be a developer working in digital healthcare industry, in Belgium, we have even 7 months boot camps that teach you how to code, how to program, how to work with machine learning, and then you can already start. Are you looking ahead to do a project on AI in healthcare? Looking ahead in the sense of, am I looking forward? Can you reformulate your question, please?
Yeah, I think it means, are you looking forward to do a project, particularly on AI in healthcare?
Yes, so I worked a lot in AI in healthcare, and I'm actually now working a little bit more in telco, and getting a bit deeper into the knowledge of telco, as I explained, 5G, and I am really enjoying being there at the moment. So I don't know if I am super looking forward to going back to health. It's always exciting, but it's also very exciting for me and my profession if I can change a lot of industries and I can see a little bit of everything.
Great. I think we've covered a lot of questions in such a small amount of time. And I would actually like to ask you if you have any advice for the learners or the aspirants out there.
Yes, so we get a lot of questions asking, what do I need to do to join digital health? So I think, as I already said, my main advice is if you want to work with digital health, you can go to a startup, you can go to a tech company, you can go to a pharma company, or just a healthcare life science company. I think you're going to be more successful going to a startup because, at least from what I've seen, when you join a big tech company or a pharma, it can be that they're going to staff you on different things. So you might not work exactly in digital health. Perhaps you're going to work on internal tools and so on. So if you're really targeted for digital health and you only want to do this, I would recommend looking for a startup for starting. And once you become an SME, once you become a subject matter expert, then you can go to bigger companies and they're definitely going to staff you on the things that you have knowledge.
Great. That was some great advice. I think we can take one more question.
Okay. The New Horizon Europe will grant a lot of money for research and have had the chance to look at it, and if so, what do you think about their topics targets? I don't know about that, but thanks for pointing out. I'm definitely gonna do my research after this call. And Maya, if you want to ping me on LinkedIn and discuss about it, please let me know. Very interesting. Didn't know about that.
Maya is actually the organizer of Women in Data Science as well. So welcome, Maya, to the chat. I think we can end the session now. Thank you so much, Karen, for taking out the time to educate us about the latest trends in healthcare. We definitely learned a lot and got inspired a lot to work in this industry as well. And for everyone who joined, thank you so much for joining us for the session and asking your doubts and talking about women in data science. It's a volunteer-driven program to raise awareness about the gender diversity, and more volunteers are welcome to join it. So please feel free to do your research and join a group that is nearest to you, or even the events are online now, so anyone can organize the event. So thank you, everyone. Thank you so much, Karen. I think we can end the session now.
Okay. Bye-bye.
Bye.